Hi, I'm Sandy Fox, and I'm a social worker, and I would invite all social workers to stand up with me now. Unfortunately, the National Association of Social Workers is not behind this, and in spite of many efforts, we need to really push them, but there are many social workers behind this. And if you saw, Kay and Frank passed out a leaflet, Healthcare Not Wealthcare, Save UPMC Braddock Rally. That's briefly what I'm going to talk about today because, as you know, community hospitals across the nation are closing. You know, the hospitals are going where the money is. They're following the money. They're not following the community need. And this is going to happen more and more. I asked to be on this panel because I do think we have an opportunity during this period of time in our country's history when, you know, given the debate in Congress, to work on building the grassroots movement by aligning ourselves with communities where services are being cut in healthcare. And services are being cut because of our for-profit healthcare system, basically. You know, the hospital in Braddock, PA, which is right outside of Pittsburgh, Braddock, PA has a strong steelworker history. If you go through the town of Braddock right now, the downtown is completely boarded up. It's very, very sad. It's a very depressed area. But UPMC, which is University of Pittsburgh Medical Center, which is huge, has a big hospital there. They put $8 million into a new entrance, and then they announced about 3 weeks ago, to the shock of the community, that they were closing the doors of the hospital on December 31st. So this has gotten huge media attention, and all of us within the single-payer movement in Pittsburgh area decided we have to protest this closing. So we got together, we connected with people in Braddock, we had our first planning meeting last Monday, and then the next planning meeting was this past Thursday night in Braddock, led by the president of Braddock Council, and there were 80 people at that second meeting. 3 television stations, all the major television stations in Pittsburgh, were there to film the planning meeting for the protest rally, which is this coming Thursday. And so I just want you to know there's tremendous energy around this, but this is also a golden opportunity for us to put into action good social work concepts in terms of bridging the gap between the haves and have-nots, the rich, the poor, the middle class, all of us working together. The co-sponsors at the bottom of the list are only a beginning. I think that the community in Pittsburgh is going to mobilize around this. The editorials in the Pittsburgh Post-Gazette have come out hard against UPMC. UPMC, by the way, is not only a medical center with multiple hospitals, they have cancer centers across the globe. They also have a private, nonprofit, supposedly health insurance conglomerate that is the second largest health insurance provider in the western Pennsylvania region. So they have a lot of interest. And the salary of the CEO of UPMC, $4.5 million, is the same amount that they said UPMC Braddock was in the hole for. So there are plans for civil disobedience that probably will occur as this fight gets underway towards the closing time. The Braddock president of the council said he's prepared to sit down in the lobby, and I think there will be many others who will join him as they prepare to close this hospital. And I just want to encourage other people to take these issues to heart and join the movement. And you know, it may not be explicitly just single payer, but it's all about people first, not profits, healthcare, not welfare, against the for-profit healthcare system. And we have an opportunity to educate people during this process of working together about how a single-payer, not-for-profit national healthcare system would take us out of the conflicts that we're facing today in this country. So I just would encourage grassroots organizers to think about this as an opportunity.